One of the most common questions I get asked by people who are suffering from these chronic, complex medical illnesses is, what testing should I get done? And before I jump into that, what do I mean by these complex medical illnesses? Well, these are when you have a whole range of diffuse, global, hard to pin down symptoms, like chronic fatigue and a bunch of IBS or gut issues, brain fog. Maybe you have crippling pain or anxiety, depression, and just mental health issue that you know doesn't match the situation you're in. Maybe you can't sleep at all. See, all of these things that don't have a nice, clean, simple answer to them, they're almost always being driven by some underlying root causes. And most people don't even know where to start, and their doctors don't send them for the right testing. So here is the absolute baseline of tests that I recommend. There's often more that you can and should do, but money can become an issue. But these are the minimum that I ask people to do if we're going to be able to help them, so we can look at everything and work out what's going on. So if you have questions about any of these, just comment below and I'll explain to you why, so that you understand, because you can go and ask your doctor to get these, but often they're just going to turn you away. So we want to do a full IgE panel, not a food sensitivity test, because they're going to be useless while you have leaky gut. But IgE is going to show what you're actually allergic to, and then you can avoid those foods while you're in the healing process. We also want to do a total tox panel. I use Vibrant Labs for these, where they'll look at mycotoxins, which is mold, environmental chemicals, and heavy metals. We need to see what your overall toxic load is. I also want people to go and do the Lyme disease and co-infections tests. So it's not just going to test for Lyme, it's going to test for all the bacteria, the Bartonella, the Babesia, all of those things, along with parasites and any underlying viruses that are also an issue, like Epstein-Barr virus. Then we want to look at some basic panels to go with it to help fill in the gaps. I like to look at the anemia panel, diabetes panel, a full lipid panel, so not just HDL, LDL, cholesterol, and triglycerides like your doctor will normally get, but there's a whole host of other apolipoproteins and things like that that you want in that panel as well. Obviously a standard CBC and comprehensive metabolic panel, because they're going to give us some great information. Make sure in that comprehensive metabolic panel they do test for alkaline phosphatase. They normally will, but that's a super important test. Hey there, if you're struggling with gut health, I just wanted to let you know about my free Facebook gut health support group. You'll see it on the screen here. Just click the link and you can join that. We cover all sorts of more in-depth tips on what testing to do, how to deal with underlying biotoxins, things like that. So jump in the group. I'd love to have you in there. Anyway, back to the video. I also like to look at uric acid, GGT, LDH, which is lactose dehydrogenase. I like to look at the inflammatory markers like high sensitive C-reactive protein and their ESR, the sedimentation rate. We definitely want to do a leaky gut panel. Again, I use Vibrant Labs for that, and it's called a wheat zoomer panel. We want to look at your fatty acid panels, your omega-3s versus omega-6, and especially the AA-EPA ratio, because that's an even more sensitive inflammatory marker than the C-reactive protein and the other ones I said. It's always good to look at vitamin D too, because that'll tell us where your immune system is struggling, and the sex hormone binding globulin, or it'll be SHBG, and also for sure a full thyroid panel. And again, not just the 3 or 4 thyroid markers that your doctor will normally get. There's 8 of them that we want to see in there, so you want to get all of those. Then if you're going to add anything else, the next ones to add is probably a hormone panel, just to have a look at what all the hormones are doing, but you don't have to have it. If you're really trying to go the bare minimum, everything I've listed is it, and then the hormones would be the next level to add on, because they're very useful, but your hormones are normally going to balance out once you take care of these underlying root causes anyway. Then if you really want to keep adding to it, I like a full stool test, or a gut zoomer that Vibrant calls it, where we look at tens of different, like 30, 40, 50 different bacteria markers and levels in the gut, so we know exactly how the health of the microbiome is, but that starts to get expensive. So if you do all of those tests I recommended, you are going to have a very clear picture of what's driving your chronic health issues, and then we know how to go about fixing it. So if you don't have a doctor that's able to help you with those things, and you want to do all that testing and work out what the heck is going on, let's book a discovery call together. The link for that's in the description of this video. There we'd spend 45 minutes together looking at your health history, what labs you've already done, and then work out what one of those labs you still need to do, so we can get the full picture and help you get the right treatment so that you can get your health back to where it should be, so that you can go back to living the normal life that all of us deserve to live.